Using an incentive spirometer. An incentive spirometer is a device that helps you take slow and deep breaths. When used correctly, it keeps your lungs working well and can help to prevent problems like pneumonia, which is an infection to the lungs. An incentive spirometer is a handheld plastic device with a tube and mouthpiece attached. There are numbers on the spirometer which show how deeply you are breathing in. The bigger yellow indicator on the left side, called a piston, moves up and down when you breathe in. The smaller indicator on the right, called a flow indicator, shows how slow or fast you are breathing in. It is possible that you may receive an incentive spirometer with a green piston and indicator. Please take note that this model works exactly the same way as the one shown in this video. Hold the incentive spirometer in an upright position and bring it to your eye level. Sit upright on the bed or in a chair and hold the spirometer in your hands. Take a deep breath in and let it out. Place the mouthpiece in your mouth, making sure your lips cover the mouthpiece completely. Breathe in slowly through the mouthpiece, like sucking through a straw, and keep the flow indicator in the target box where the smiley face is. Taking a deep breath will raise the piston in the chamber. You are encouraged to raise the piston to the level set by your nurse or therapist. After breathing in, hold your breath for 3 seconds, then let it out slowly. Breathing in slowly and deeply will keep the air in your lungs longer to fill up the spaces that are not as well inflated, such as the spaces at the bottom of your lungs. Taking in deep breaths will also help to move any phlegm in your lungs to the central airways, making it easier for you to cough them out. You are encouraged to use the incentive spirometer regularly, as it can help to keep your lungs working well and prevent complications while you are staying in the hospital. We recommend that you practice 10 deep breaths with the incentive spirometer every hour that you are awake. These breaths do not need to be one after another and can be broken up into sets of 2 to 3 breaths each practice. After each use, disconnect the mouthpiece from the device and clean it by washing it with soap and water, followed by rinsing it with distilled drinking water, or using a tissue to wipe it if you do not have access to the above cleaning materials. Clean the external surface of the incentive spirometer with alcohol wipes and use a plastic bag to store the entire device. In order to prevent the buildup of phlegm in your lungs and reduce the risk of lung infections, we encourage you to cough or huff to clear your phlegm regularly. However, if you have just undergone surgery or have a rib fracture, you may experience pain over your abdomen or chest when doing this. Here are some methods you may use to help reduce pain when coughing. If you have undergone a recent abdominal surgery and experience pain over your surgical site, you may use this technique. Sit upright on the bed or in a chair. Place a rolled up towel over your abdomen where you are experiencing pain. While applying a gentle pressure, take a deep breath in through your nose and cough. If you have undergone a recent thoracic surgery and have pain over your surgical site, or if you are experiencing pain from rib fractures, you may use this technique. Sit upright on the bed or in a chair. Place a roll of towel over the side of your body or chest where you are experiencing pain. While applying a gentle pressure, take a deep breath in through your nose and cough. If coughing is too painful, you may do a huff instead. Take a deep breath through your nose and exhale forcefully. Huffing is like exhaling onto a mirror or window to steam it up. If you are experiencing increasing pain, breathlessness, or giddiness while performing any of these breathing techniques, please stop your exercise and monitor your symptoms. If you are in the wards, please inform a nurse or doctor immediately. If you are at home, please see a doctor or call an ambulance in case of emergency. We wish you a speedy recovery.